funny, when I started this presentation, it was like right before that, I started to get a migraine. I have migraine now. So if it looks a little weird and disjointed and I start not making sense, that's why. But I'm gonna talk a little bit throughout, like kind of about some of the things that I experienced too, because why not? But I am not the migraine monolith. There's probably some of you in here who get migraines that look a lot different than mine, so. Okay, so migraines are a really common neurological condition. About 12% of people in the US have it, and more than 1 billion people worldwide. It tends to be hereditary. They say that up to like 80% of people who have migraines have a first-degree relative who also have them. Women are 3 times more likely to have migraines than men, and the experience of having a migraine can vary a lot from person to person. There are really like 2 main typical types of migraine: the classic one with the aura, and then common without the aura. They say that about 1/3 of people with migraine have the aura. And then there are some of the rarer types, like the hemiplegic, the ophthalmoplegic, the vestibular, basilar, abdominal, and like silent with just no headache. There are 4 phases of a migraine, but not everyone will have all 4. There's the prodrome, aura, attack, and the postdrome. The prodrome is typically about 1 to 2 days before the attack starts, and it can include like mood changes, trouble sleeping, difficulty concentrating, yawning a lot, food cravings, and constipation. They say about 75% of people experience the prodrome, but it often goes unrecognized. Like, I never know, and then I'm like, oh, wait, like that's, okay, I should have known that. I really should have known that. The aura, like I said, is in about 1/3 of people who have migraines. It typically occurs 5 to 60 minutes before the attack, but they say it can happen up to 24 hours prior. The symptoms typically begin gradually, build up over several minutes, and last up to an hour. And they include vision changes, like seeing bright spots or flashes of light, or even vision loss. Ringing in the ears, noticing strange smells, difficulty speaking, tingling, muscle weakness, and allodynia. This is a video that I found from Mayo Clinic that is just like an example of what something you might see in an aura. It's just blurry in general, but I don't know if that was on purpose. It's just really, like a lot of the time there's like flashing zigzag lights and like areas where you just can't see. Not this current migraine, but a couple of months ago, I had one and it started, I was like in past tutoring and we were doing like a Kahoot or something. And I was sitting and I'm like, oh, I can't see the tutor space anymore. I can't see the board anymore. I cannot read a single thing on the board. That's great, whatever, I can still hear. And then I started having like hearing, like it sounded like she could have been speaking Swahili. I would not have known the difference. Like I had no idea, couldn't see, couldn't hear. Started having like super muscle weakness. We finally got out of the tutoring. I'm like walking down the stairs, about to face plant down the stairs. There's one of like the staff members at the bottom of the stairs asking me a question, and I just felt so stupid. Like, I'm so sorry. I have no idea what you're saying. I cannot respond. Like, it was just really weird. I don't think that's really typical, but the attack is obviously like what most people think of with the headache, which is typically lasts 4 to 72 hours. It can last longer. It's like a really pounding headache, typically on one side of the head, but it can be on both sides, and it tends to get worse with physical activity and bright lights, loud noises, strong odors. And you can also have nausea, vomiting, light sensitivity, sound sensitivity, sometimes sensitivity to smell and touch as well, and chills, fatigue, a lot of that.
And so I'm a migraine girly too, and my skin will be sensitive, like to the point like clothing hurts whenever I get a really bad one.
There's the post-drome, which is in about 80% of people, lasts a few hours to multiple days after the attack has ended. Sometimes there'll be like fatigue, body aches, trouble concentrating, dizziness, sensitivity to light. But I've really never talked to people about post-drome. I don't have much of one myself. This is just like a little bit of the physiology. It says 2 minutes, but I really like hacked it down to like a minute.
The headache phase of a migraine is thought to be attributable to the activation of the trigeminal nerve, a cranial nerve that acts as the main sensory nerve for the head. The trigeminal nerve supplies a variety of pain-sensitive structures, including the eye, dura mater, and various blood vessels. Activation of the trigeminal nerve can elicit pain in these structures, which might explain the characteristic head and eye pain of migraine. Activation of the trigeminal nerve also prompts the release of neurotransmitters that can dilate cranial blood vessels and further stimulate and sensitize pain receptors. Additionally, trigeminal nerve fibers synapse on neurons that project to various brain regions, and these connections might be responsible for eliciting other common symptoms, such as auditory, visual, emotional, and cognitive effects. People who experience migraines may undergo neurological changes that increase sensitivity to migraine triggers, but it's still not completely clear what causes a migraine attack to begin. Migraine aura has been linked to a spreading abnormality in the electrical activity in the brain known as cortical spreading depression, which prompts other alterations in brain activity and is linked to the activation of the trigeminal system. This spreading depression has been suggested as a mechanism for the initiation of migraine without aura as well, although there is no consensus on this point, and other mechanisms that lead to trigeminal nerve stimulation may be involved.
So like with that, when it was talking about like the dilation of the blood vessels, I'm getting ahead of myself, but like the Excedrin migraine is one thing that's like very common to take over the counter for migraines, and the reason why is because it has like a little bit of caffeine in it, which like works kind of like counteract the dilation. And sometimes I hear people that are like, if you have a migraine that will not go away, go to McDonald's, get some salty fries, get a Coke, and like sometimes that's just what people need, just because of like the dilation of the blood vessels, and then it's like, not doing that anymore.
The headache phase of
There we go. Okay. There are various causes and triggers. Like the causes can be, like we said, genetic, a traumatic brain injury, hormonal changes, which is kind of why they say it's more common in women, I think, and certain medications like nitroglycerin, Viagra, birth control. Especially with estrogen, they say that like if you have migraine with aura, like do not get on any sort of estrogen containing birth control. And hormone replacement therapy, especially in menopausal women. And then stress is the #1 trigger for people who do have migraines. And then certain foods that really vary from person to person, but common ones are like aged cheese, chocolate, nitrates like in hot dogs, fermented foods, aspartame, caffeine is a big one. When Panera had the charged lemonades, I made the mistake of not seeing that it was a charged lemonade and drank like a cup and a half of it, and that, I was not spared. But then they also say like caffeine helps, and I think it really just kind of varies from person to person because caffeine doesn't do anything to me. But also tobacco and alcohol, missing sleep, or getting too much, which is really sick. Weather changes, especially like barometric pressure, brighter flashing lights. For me, even like when we do the eye movements, when we do like the saccades, and it's just like looks like one of those little rolling things with the red and the white, and it's just scrolling. Even that'll do it for me. Just I don't know. It's very strange. Strong smells, loud sounds, and like for the diagnosis, there's no one test. Sometimes they'll do like a CT or an MRI. If somebody presents particularly abnormally and they suspect like a brain tumor or something, but the criteria is here. It just really has to do with the collection of symptoms that are present, and the diagnosis kind of up to your questions and how they answer. So like without the aura, you need the headache that lasts 4 to 72 hours when untreated. It has to be 2 of the following: unilateral location, pulsating quality, moderate or severe, intensity, aggravation, when physical activity is happening, and at least either nausea and or vomiting or light or sound sensitivity. And then with the aura, it's the same criteria with the headache, and then you have to have like 1 fully reversible aura symptom, and then it has to have, again, like 3 of the following 6 characteristics: that at least one spreads gradually, 2 or more occur in succession, they last 5 to 60 minutes each, 1 is unilateral, 1 is positive, and it's accompanied or followed within 60 minutes by the headache. And of course there's like the medications, and I know that's not us, but like there's the acute abortive ones for when it's already started. It can be pain relievers, over the counter, like Advil or the Excedrin migraine, or prescription triptans, the oral calcitonin, gene-related peptide antagonists. The ones that I like put the brand name, I don't know if y'all are always seeing those medication commercials, where like side effect is death, but those are just the ones that I've seen lately, like the Ubrelvy and the Nurtec ODT, and then like anti-nausea if you experience that as a symptom, and then the preventatives can be like anticonvulsants, beta blockers like mitogram, antidepressants, CGRP, monoclonal antibody injections like the Aimovig, Ajovy, and Emgality, and then some people get like Botox injections around their head, and that I've heard a lot of people say that's really helpful, which is cool. But they do say that some of these medications, like especially the pain relievers and the triptans, can cause rebound headaches. Like if you take it too frequently, then the pain can return faster and more debilitating. So they say like definitely use those carefully. So as chiropractors, more so in our scope, we could like encourage lifestyle changes, like getting enough sleep, going to bed at the same time every night, not skipping meals, avoiding whatever food triggers that person may have, and of course managing stress, since that's the number 1 thing. Suggesting some nutritional supplementation. These are just a few that are, I guess, more common, like fever, magnesium, CoQ10 and B complex. A lot of the time they'll have you do like a migraine diary, like something like that. And they also have apps too, like that are more in depth, I guess, but something like that to kind of pin down what specifically may trigger that person. I had to say something about the FL41 glasses. Those are the ones that I'm always wearing because I already said it, but I have a particular problem with light. Like it triggers it, and then once it's there, it's even worse, and I'm just light sensitive all the time. But like glasses like these, they filter out like about 80% of blue and green lights that tend to be more like bothersome to people who are particularly sensitive to light. and I have myself found them extremely helpful, more than anything really. And I've heard a lot of other people have the same thing, or that's just really helpful. So that could be something to keep in mind if they have particular light sensitivity. Vagus nerve stimulation they've found has been helpful. Soft tissue therapies, especially like in the cervical region, there's a lot of the time a lot of muscle tightness, especially, and then of course the chiropractic adjustment, seeing as we're chiropractors, or going to be. And they found that particularly like cervical and within the upper cervical, adjustments have been found to be really helpful more than anything. And that's all I have. Any questions?